Hi, this is Randy Wyckoff, the Dean of the College of Public Health at East Tennessee State University. And I want to talk to you today about a question that has come up quite a bit. And that is COVID-19, actually SARS-CoV-2, a man-made disease that escaped from a research lab or was purposely released in China? In keeping with our theory on alternative explanations, I have to be willing to accept that this might be true. And when I've looked at it, I think there's four basic reasons, perhaps a fifth, why some people believe that it might be man-made. The first, of course, is it appeared out of the blue. It didn't exist before, and all of a sudden, here is this worldwide disease that's killed approaching 500,000 people. And that looks like something that may have been man-made. The second reason people may believe that SARS-CoV-2 is because it includes genetic material that may be representative of coronaviruses from bats and even pangolins. And the theory would be that how can a virus have characteristics of different animal viruses if it wasn't man-made? The third reason some people believe that SARS-CoV-2 was man-made is because it appeared in China, a country with whom the U.S. has some strained relations, at least recently. And finally, of course, there are folks who know that for years, folks have been trying to develop biological weapons, and it's at least theoretically possible that SARS-CoV-2, COVID-19, would have been part of that effort. So let's look at each of these. In terms of it appearing out of the blue suddenly, that's actually not that unusual. Every epidemic that I can think of has appeared suddenly out of the blue, and no one's willing to accept that in 1340s, the plague was a man-made disease, or that measles or that polio was. This is how epidemic diseases happen. They do appear quickly. They spread. If they're an easy virus or easy disease to spread, they spread, and then they cause the kind of disease that we're seeing. The second idea that there's genetic material from different species, this is in fact not uncommon. This is the way viruses grow and mutate. We all know that every year there's a different flu and different influenza virus. The viruses do evolve and change over time. The third justification is that it came from China, the idea that perhaps the Chinese were trying to cause some harm to the US. But I would remind you that this is a disease that has affected every country in the world, including China, and a pretty significant economic impact in China as well. And it wouldn't make a lot of sense to have created something that would cause such widespread impact. And then the fourth explanation is that this might be a biological weapon of some sort. And, there again, if you were making a biological weapon and it killed less than 0.5% of the people that it infected, it wouldn't be a very effective biological weapon, especially if those deaths occur largely in people over the age of 75. And not in the key age range that you normally want to attack in a biological weapon. So again, that makes me doubt that this is a man-made virus. There's a fifth reason, and it's worth talking about a little bit, that some people believe that this is man-made, and that's because it has been widely reported on social media. And this is an area of particular concern of mine, because increasingly it's becoming clear that there are folks who are purposely uploading misleading information, whether it's about vaccines or COVID-19. There are folks, whether they're internal or external to the U.S., I'll leave that for others to discuss, but there are folks who clearly want to divide us. I think when you look at all the information, SARS-CoV-2, COVID-19 looks like a natural pandemic disease, just like ones we've had over the centuries of recorded human history. And let's accept one other fact. Even if we'll never know the origin, let's understand that it's affecting all of us around the world, and that we really have to do, regardless of where the virus came from, we have to do the things that we need to do to control it on a global level. I appreciate that not everyone may share my opinion on this. If you have any thoughts or questions, feel free to share them with me. I'd be happy to try to address them or find answers. Thank you very much.